Good afternoon. I'm Dr. Duke Majan, CEO and founder of Duke Spine Institute. Today we're going to be doing spine surgery live, broadcasted on Facebook, X, YouTube, LinkedIn, and various other platforms. Our patient comes from a local area, and she has a herniated disc at C6-C7. You can see that on the MRI scan down at the bottom corner. It is a tear in the back of the disc in the wall called the annular tear, and the jelly from the center that was damaged during the trauma causing the tear pushes out the back of the tear and is now causing neck pain and symptoms going into her shoulders. That's pain going from her neck into her shoulder. We call that cervical brachial pain. So we're going to go in and fix that disc. We're going to use a laser and an endoscope. That way she doesn't need an open surgery. It's going to be endoscopic. We'll do it through a 4mm incision. Unlike other surgeons that would do a fusion or artificial disc, there's no need for a big incision. There's no need for trauma to the tissues underneath the skin. There's no need for metal or plastic or biologics. This is going to be a natural repair of the disc. Henry, let's show the audience the 30 different causes of neck pain while I'm gaining access to the disc itself.
Copy that.
I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. You can see from our video there's about 30 different causes of neck pain, including the discs that can become injured. That's 85% of chronic neck pain is the disc injury. And then there's facet joints, which account for about 10%. So the vast majority of neck pain that's chronic comes from disc injuries. She has a disc injury at C6-7. It's the bottom disc in the neck. And you can see from the x-ray here, Henry, you can see the needle going in the front.
Yes, we can.
It's inside the disc. And then you can see the endotracheal tube because she's intubated under general anesthesia. And then you got the esophageal temperature probe, which is braided, and it's that one right there. Notice from the esophagus, normally it's in the middle. Where is the esophagus? Normally there, up and down there. Yep, but it's pushed to the side because that's what I had to do to get the needle in. So we displace the esophagus and trachea medially, the carotid sheath laterally, go between them to get into the front of the disc. Now we're going to do our discogram, and then we're going to do the surgery. Shot. You can see on the lateral view, the needle is at C6-7. Let's count. C2, 3, 4, 5, 6, 7. Is the mouse not working right? All right. C6-7, everyone agrees, correct level? And you're going to see when I inject the dye, there's going to be a tear in the back of this disc at C6-7 with a herniation. Show us where that will be, Jordan. Show us where the tear will be. It'll be in the back of the annulus right there. So let's go ahead and do that. Shot. And there it is. You can see the tear right there. Show us the tear. Perfect. Put the arrow just below it. Henry, take a screenshot.
Copy that.
Just go a little below it. Yeah, right there. That is the tear. Massive. Beautiful. Show us the herniation. You can see it right there, the herniation. Perfect. So, this is going to be a great case. She's been in pain from her neck radiating into her shoulders, headaches, and symptoms in her arms. We're going to fix that today. Now, to do that, we have to make a small cut. The incision is literally 4 millimeters. We're not going to lose any blood. You got 1 drop of blood, that's it. So we're going to do a small 4 millimeter incision. The whole surgery is done arthroscopically. You are watching the very future of spine surgery done here today at Duke Spine Institute, the pioneers in spine surgery for degenerative spine conditions. Bulging disc, herniated disc, ruptured disc, protruding discs, they're all different forms of degenerative spine disease. The number one cause of pain and symptoms in the spine, in the neck and back, is degenerative conditions. And Duke Spine Institute is the leader in the world, pioneering new technologies to cure back and neck pain with less invasive treatments that are more effective, faster recovery, and faster return to normal. All right, there's the incision. We're going in the incision. You can see that right there, Henry?
Yes, we can.
It's a 4 millimeter cut, just 4 little millimeters. We're going to go down with this dilator. We want to watch our guide wire shot. Make sure the guide wire does not advance backwards. That would be bad. Now we're in the front of the spine. I can feel the front of the spine. I'm right in front. Show us the front of the spine. Yes, do an AP view. We want to try to be in the middle. Now you can cheat a little bit left and right from the middle, 5 millimeters each direction. It's called the anterior longitudinal ligament. You're working between the longest coli muscles. Perfect. You see we're dead center. Show us the tip, Jordan. Show us we're dead center. You can tell we're dead center because you can see the spinous processes. One there and one there. And there's a line between the middle of the spinous process, and that's exactly where our tip is. So it's perfect technique. So far, she's made it easy for me. Now I have to advance through the ALL and the anterior annulus. Shot. We're going to head to that tear in the back. Hold on. Shot. All right. I've taken the guide wire out, and now I'm going to dilate right through the anterior longitudinal ligament and the anterior annulus or ring, going through the middle of the disc, and now we are entering the tear. Show us where the tear is. You guys see the tear there?
Yes, we do.
All right, and we are entering the tear. Well, not yet, not in. Yeah. Okay. Shot. I'm going to go to the back of the tear. See? There we go. Now I'm at the base of the part of the herniation that's sticking out backwards. All right? We want to be right there. Perfect. Check this out, folks. The whole surgery, the Duke laser disc repair, is done through a tube that's 4 millimeters wide. See that?
Yes, we do.
That's the outer diameter, by the way, not the inner diameter. Inner diameter is 2.8 millimeters. So the whole surgery is done through a space 2.8 millimeters. Why doesn't your surgeon do this? Because they're not trained to do it. It's the future. They haven't learned this yet. This is too advanced for them. What they're being taught, inline traction, Dr. B, what their surgeon is being taught at the university where they trained is to do fusions and metal implants, which is what those companies that sell those devices want them doing. They're doing what's best for the company. We at Duke Spine are doing what's best for the patient. That's the difference. Now, in the old days when we didn't have Duke laser disc repair, then fusion was the next best thing, or artificial disc, and that's what I used to do until I pioneered this technology. And now with this technology, there's no reason to do fusion anymore. All right, unless you have an unstable fracture from a slip and fall or motor vehicle accident. We are now at the back of the disc. Perfect. We're ready to take the dilator out and start the surgery. You guys see the front of the neck? There's a tube.
Yes, we do.
Now she's asleep. Nobody in the world could tolerate this being awake. So these patients must be under general anesthesia. When I learned this technique 19 years ago from the Koreans, they had their patients awake. And the patients were squirming around on the table, like wiggling around, moving around because it was so painful. I said, nope, my patients are going to be asleep, so they don't move around. The Koreans ended up having complications. They had spinal cord injuries and other problems. I've never had those problems in 19 years of doing the surgery that I did because we do it better, frankly. Any questions?
Yes, we have two questions, both coming from Faisal on Facebook.
Hello, Faisal.
First, question.
Hold on. There is the tear, folks, right there. You guys see it?
Yes, we do.
And we're going to use the laser. This laser, unlike the last laser, this laser is, remember the last laser we used in the back? It was 1 millimeter wide. This laser is half of a millimeter wide. So this is skinnier than the last one. All right, let's go ahead and take the questions.
First question coming from Faisal on Facebook asking, Doctor, what causes muscle spasms in the neck?
What causes muscle spasms in the neck?
Correct.
The answer is joint pain. Joint pain is number one. So if you have a disc herniation and it's hurting you, the disc is a joint and it hurts. So it's joint pain. That causes muscle spasms. The second most common cause is facet joint pain. So disc joint pain, facet joint pain, and then the third is like a whiplash. If you get into a car accident and suddenly your neck is wrenched in a whiplash pattern, you're going to have muscle spasms because you injured the muscle. The muscle itself is injured. Okay, so joint pain from the disc or facet, number one cause, and then number two cause is trauma to the muscle itself where you tear the muscle. It's a muscular injury. It's called a muscular sprain or strain. Okay? Muscle spasms from trauma go away in 24 to 48 hours on their own. Muscle spasms from joint pain never go away. They keep coming back. They get better for a few hours, then they come back again as soon as you're active. If you're having muscle pain in your neck, you need to do an MRI review with Duke Spine, and we need to fix your problem. It is not going to go away on its own.
Next question coming from Faisal.
Hold on. Before you do that, I want to show you this. This is the foramen on the left. Look at that, okay? There's herniation pushing on the dura, the nerve root right there. That's a piece of herniation. I'm literally removing this herniation at 0.1 millimeter. And actually, sometimes I can even remove 0.5 millimeter. Sorry, 0.05. 0.05, half of a millimeter at a time. I can remove the herniation. That's how precise this laser is. That's how precise this technique is. Now, if you have open neck surgery, the surgeon will never give you 0.05 millimeter precision. Only possible endoscopically, only possible with laser. All right, Faisal will take your question, and then Henry, I want you to show the audience how is it that a disc injury causes so much pain.
Copy that. And the next question from Faisal once more on Facebook asking, how is this patient getting headaches that is a symptom, doctor?
Yeah, great question, Faisal. Look at that herniation right there. Look at that. It just came out of that hole. All right, let me clean this. So headaches are pain, and like all pain, what do we learn? It comes from inflammation. So what is being inflamed that's causing the headaches? What's inflamed is the dura mater. The dura mater is the white, there's a herniation right there. The dura mater is the white covering around the spinal cord that goes up and around the brain. So anything that causes inflammation in the neck that affects the dura, the covering around the spinal cord and brain, can go up and irritate the brain itself, and not the brain, but the covering of the brain. There's the herniation. You guys see that?
Yes, we do.
Right there. We just pulled it out, It's about 5 millimeters wide. Not big, but that's only one herniation. That's not the only one in there. There's more. So we've been zapping the herniations out for a little while, and we got more to take. There's another herniation right there. Look at that. Another one. That one's about 3 millimeters. Here it comes. Up and out. It's floating it right out. This is how we remove the herniations at the back of the disc. So the idea of not opening the neck, but to do a minimally invasive endoscopic surgery was the idea of the Korean surgeons, neurosurgeon, Dr. Seng-Ho Lee. It was actually my idea too, but Dr. Seng-Ho Lee beat me to the procedure of doing this. He developed this technique going through the disc called transdiscal, and I actually thought of it as well, but I was too young in my career to do anything about it. He was much further along, and he actually pioneered the equipment and the technique, so he deserves that credit. Then I took his endoscopic transdiscal technique, which was the best endoscopic technique for the cervical spine, and I added the laser debridement of the annulus, and that is my contribution. And by doing this, not only do we get rid of neck pain, we get rid of arm pain, we get rid of weakness, numbness, and tingling in the arm, and we get rid of myelopathic symptoms, which is spinal cord damage symptoms. Any other questions?
Yes, we have a question coming from Ramazan on YouTube.
Hello, Ramazan. Welcome.
First saying, hi, Dr. Duke.
Hi.
I'm watching your operation from Australia. Firstly, thank you so much for showing live operation for
You're
us
welcome.
on YouTube, which means you are a very honest doctor in the world. 100% thank you for what you're doing.
Thank you.
My question is, I got multi-level spondylosis, degenerative disc disease, narrowing canal at C5, C6, C7, canal narrowing.
5 minutes. Go ahead.
Mild multi-level facet arthropathy.
Yes, I understand. These are all MRI findings.
Yeah.
We can help you. I'm not sure what your question is, but very typical findings on an MRI, completely treatable with our treatments. We can get rid of your symptoms. You just need to come to Florida. What was his question?
I thought it was a question. I think it was just seeking advice and or comment.
Yeah.
That's what we have.
So
far.
my friend, the best thing to do is what I tell everybody. Do a free MRI review with me. We don't charge. You can do it from the comfort of your home. And that's the only way I can diagnose your problem. Your MRI will never tell you where your symptoms come from. There's no MRI in the world that says your pain is coming from this structure. Okay? And that's why doctors cannot diagnose pain or cure pain, because the MRI doesn't tell them where it's coming from. The doctor has to figure that out based on their experience and knowledge. And my experience and knowledge is very good, and I know exactly where the pain comes from. I can figure it out in every single patient. And once I know the source, I can fix it. That's the key. I'm telling you this for one reason, because I don't want people out there to suffer in pain anymore, believing that there's no cure for them. There is a cure. You just have to go to the right place. You know, if you want to see the Taj Mahal, you have to go to India. You can't go to Paris. You can't go to Orlando. You're not going to see the Taj Mahal. You might see a picture or a fake, but the real Taj Mahal is in India. The real place to cure your pain is at Duke Spine Institute. It is the only place in the world that you can go. All right, those are fibers of the posterior ligament right there. I just cut through them, cutting through them at 0.05 millimeters. Why? Because there's still some herniation here that I want to remove. You guys see the scar tissue there?
Yes, we do.
It's literally sitting on top of her spinal cord. Okay, we don't want to damage the spinal cord, so I have to be very careful. But this is where the Koreans failed. I'm going to flip and go back the other way. We're almost done. We have about 2 minutes left. So ask your questions. I can come and answer them face to face. But I'd like to show some more video right now. Henry, let's show the audience how, do we show them how the disc causes pain?
Not yet.
Let's do that.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. So you can see from our video how the disc itself can cause pain in the neck, headaches, neck pain, cervical brachial pain, and pain down the arm. It's all due to inflammation from the disc. I've been teaching doctors this and public this for 18 years now. And unfortunately, they don't listen. The public is listening, but doctors don't listen. Doctors just put their head in the sand and pretend like they don't understand what causes pain, even though I've been telling them. They don't want to hear it. The truth is, they just want to keep treating their patients with treatments that don't work. Because the moment you identify the source of pain as a doctor and you actually fix it, then the patient goes away and you never see them again. And you don't make any more money. So these doctors want patients to stay in pain so they can keep making money off the patients by treating their pain. We don't want patients to stay in pain now that we have a cure. We want people to be out of pain. We're just a different kind of company. We're not motivated by greed. We're motivated by the desire to help people get better and have normal lives. All right, Henry, let's show the audience, how does this Duke laser disc repair work?
Copy that.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. So, Henry, we've shown the audience how a disc causes pain. We've shown the audience how we fix it with laser. Let's show the audience how a facet joint causes pain, which is the second most common cause of neck pain, by the way. All right, welcome back. So type up your questions because we're done. I'm going to come and answer them for you face to face. And I'll take all the questions you want to give me. And the next surgery we're going to be doing is a lower back, right? Laser for disc problem and what else? We're going to do any facets?
Yes, sir. I think any facet.
We have facets, disc, thoracic facets too. She comes from Minnesota. She's here to get fixed because they can't fix her in Minnesota. But we can fix her here at Duke Spine. Oh, this is like the never-ending herniation. Every time I look back, there's another piece that's just popped out. These are all pieces of herniation, you guys. That's how much herniation there is here. Honestly, it's a lot. It's a little bone spur right there. Type your questions and I will come answer them for you. Little bone spur. But pretty much we're done. I just gotta, every time I look back over here, there's another herniation. Look at that again. That happens. That means when she hurt herself, she broke her disc into a lot of little pieces. And those pieces of nucleus pulposus are fragments. I call them fragments. And they are just wanting to come out. There's another one. Look at that. Now she's asleep. She's under general anesthesia. She's completely out of it, fully relaxed, not moving. We're going to have to wake her up. We call it resuscitation, recovery, emergence. She's going to emerge. Here we go. That should be it. I don't really see any more. That's the back of the disc. You guys see the bony edge right there and the bony edge?
Yes, we do.
We're literally looking at the back of the disc. And this is just a few more fibers, some scar tissue. I want to make sure I'm not leaving too much. Remember, we never get 100%. Not possible. Sometimes when you release some of the scar tissue, more herniation pops out. But I am not seeing much left. And I think she's going to do really good with this. Let's see. Let me just check this one last area. It looks a little full. A lot of scar tissue here. Just not seeing any more herniation. There is a little layer of scar tissue, and I don't want to leave anything more than just a little layer of scar tissue. Okay? I don't really see any more. I don't see any more. Underneath those fibers is the spinal cord. We want to stay away from that. We don't want to be anywhere near the spinal cord. Oh, there was a piece of herniation. You guys see that?
Yes, we did.
Came out. All right, we're done. Feel good about it? Type your questions, come and answer, but we're done. I'll show you the incision in a moment. It's just 4 millimeters. This is the future of spine surgery, and it's being led here at Duke Spine Institute by our team of very highly trained healthcare providers. It's outpatient. We've never had a complication in this surgery, never, in 18 and a half years. So it shows you just how safe this surgery is, even though we're sticking metal tubes in people's neck, right? Seems scary, but it's a lot safer than the alternative, which is fusions and artificial discs. All right, we lost probably, I don't know, 20 drops of blood, maybe 1 cc. That's about it. Okay. Here's the blood loss right here. Got a drop there, got 2 drops there, got about 2 drops there. So maybe we lost 10 drops of blood. Any other videos we want to show?
We could show how to cure facetogenic neck pain.
Let's do that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Good morning, I'm Dr. Duke Majan at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then?
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used the laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here. Great testimonial. Henry, great job on the surgery. Thank you so much. I am Dr. Duke Majan, the CEO and founder of Duke Spine. And what you've just watched is what's called the Duke Laser Disc Repair Surgery. It's only done here that I know of. There are doctors that watch my surgeries. We train, and they may be doing these procedures as well in other parts of the world. But this is where it all started. We've peer-reviewed and published our work many years ago, about 13 years ago. And this patient comes to us with a pretty good herniation going backwards towards the spinal cord at C6-C7. For those of you who don't know what that is, that's the number 6 bone, number 7 bone, that's the 6-7 disc, and the herniation is in the back of those. It's going to be hard to see with the nerve root there. Look at that tear. Look at the jelly coming out. You guys see that?
Yes, we do.
Right there. You guys see that's what a herniation is. It's the jelly squeezing out of the tear. Huh?
Yes.
Not bad.
That's not bad at all.
All right.
Yeah.
So what I did, I went through the disc with a small tube. I went to the back where the herniation is. I used a laser to remove it. The advantage of this surgery, number one, we are not taking the disc out. All the other surgeries, they take the disc out, the whole disc, and then they put a metal or plastic disc in there. We're not putting a metal plate. We put nothing unnatural in your body. It's a natural repair of the disc, and the disc stays. We only take the herniation and we clean the tear, called the debridement. Number two, it's 4mm incision, Band-Aid. There's literally no trauma inside your body. It's just dilating or spreading the tissues and then taking the tube out, the tissues go back. If you do the other types of open surgery, the surgeon is ripping apart scar tissue, bleeding, everything is being destroyed inside. That's why you have trouble swallowing and hoarseness and other problems, okay? With this laser surgery, there's none of that damage. Then with the laser surgery, there's no need for painkiller after surgery. We don't give you narcotics afterwards. You know, when you go have a fusion or artificial disc, the surgeon writes a prescription for Percocet, oxycodone, oxymorphone, dilaudid, hydromorphone, whatever. All those are powerful painkillers. Why? Why do you need powerful painkillers after open surgery on your spine? Because the surgeon is destroying your body during the surgery. They are destroying the normal body to get to the spine. Then they're destroying your spine. No destruction with the Duke Laser Disc Repair. No inflammation, no pain, no need for painkillers. Our patients can go back to work the next day after their surgery. If you have a fusion or artificial disc, you're not going back to work for weeks or months because it hurts so bad. It hurts because the surgeon ruined inside your body. Don't let them do it. I've been trying to teach them not to do this for years. They don't listen because they make so much money doing fusions and artificial discs, they can't help themselves. They want to keep doing it. But you know better. All right.
All right. The first question coming from the Classic Car Nut on YouTube.
Classic Car Nut, how are you?
Asking, hi, the practice that performs disc seal emailed me info with a new publication stating that they have proven effective and able to replace most spine surgeries in a recent study. I'm skeptical. Thoughts?
Yeah, there's no end to the marketing nonsense that these companies will try to do, promote their products so that surgeons will stick it in patients. What's happening is disc seal doesn't work. So doctors and patients are figuring that out, and now they have a new round of studies with maybe even a tweak on the product that, oh, now it works. Bullshit, it doesn't work. That's like saying, you know, we take a poker and we stick it in your eyeball, and now it made you blind, so now we're going to heat the poker up in the fire and then we're going to stick it in your eyeball. It's still going to make you blind. It's a bad result no matter what. If you want to do disc seal, do disc seal. I'm not telling you not to do it. I'm telling you it doesn't work, it's dangerous, and it's not worth it, okay? But if you want to go do disc seal out there, by all means do disc seal. And when it doesn't work, you come to Duke Spine and then we'll fix you. I don't have any animosity at all. I'm not, for people, my goal is to educate people about the truth. If you hear the truth, you go out and do something else, and then you come back to me, I will take you back with open arms. I have no animosity. I'm not jealous. Nothing. Duke Spine, as long as I'm alive, and my future legacy will always be here to help people, even when you make bad choices. All right? Give me 1 second. Hello? Sorry about that. HR, got to take the call. Anyway, my point is, Disc Seal does not work. I would never do it on a patient. I would never recommend it on a patient. It's garbage. You've got to understand what's happening. There is venture capital money. These are people that are super rich, that have hundreds of millions of dollars, and they need to what's called deploy the capital. What that means is they're looking for an investment that they can stick their money into, $100 million into a company, and then just gain huge profits back. Now, they don't give a shit if they're hurting people with their product. They don't care. They're not doctors. These are Wall Street people. They don't give a shit about you, all right? They don't care about your results. All they care about is the surgeon willing to stick a needle in your spine and inject their garbage into your spine? That's all they care about. And they will go out and market it. They'll produce papers. They'll hire doctors to write papers. They'll concoct the evidence. They'll make up bullshit. This has been going on for years. This has been going on for a long time. Made up results for scientific studies. It's been going on for 50, 60, 70 years now. As a matter of fact, all these publications now in journals and medical journals are completely untrustworthy because they are all sponsored by industry. You see, a journal, a medical journal, is a publication. It's literally a paper publication. It's literally 150 pages. It's got about 20 different articles in it, and it has advertisements, okay? Advertisements. If you open up a medical journal, there's advertisements. There will be an advertisement for Disc Seal. Now, here's how it works. The editor of that journal says, I want to get rich. And then the venture capital company says, we'll make you rich. Just publish our garbage studies so that surgeons will inject our shit into people's spine. And the editor goes, yes, I'll publish it for you, but you've got to pay $1 million in advertisement to my journal this year. And then the venture capitalists say, sure, we have $100 million, spend $1 million on advertising in the journal. Then the editor says, great, thank you, we'll publish your garbage study. I'm telling you, as a scientist who reads these studies all the time, these studies are garbage, and they've been garbage for years. Artificial disc studies, garbage. Disc seal, garbage. Barricade, garbage. Mild procedure, garbage. Spinal cord stimulators for pain, garbage. All of it is nonsense, made up science. And it's being published because the public's bar of, hey, I'll do this on my body as long as it's published in a scientific journal, is here. That's the bar. Well, now the editors are saying, sure, give us money and we'll publish your garbage so that the patients will believe you. Sorry, folks, I'm not interested in lies and deceit. I'm interested in the truth. The truth is Disc Seal is garbage. It will always be garbage. It doesn't work. It never will work. But if you do it and you want me to fix you afterwards, I will fix you. No problem.
Next question coming from Ramazan on YouTube asking, Doctor, can you fix multiple cervical spondylosis permanently?
Yes. So Ramazan, and like many people, is asking, if you have a degenerated disc in your neck, and multiple, like 3 of them, 2 of them, 4 of them, can I fix them all at the same time? Yes, I can. Can I fix the symptoms from them? Yes, I can. Are your discs going to look normal afterwards? Absolutely not. No surgery in the world done on the spine will make your spine look normal. If your spine is not normal going into surgery, it will never look normal coming out of surgery. If you look at every single surgery done in the world on the spine, no surgery will make your disc and your spine look normal, period. The goal of surgery is not to make your spine look normal on an MRI, CAT scan, X-ray. The goal of surgery is to take your pain away, to get the arm symptoms gone, to get the neck pain gone, to get the headaches gone. That's the goal of surgery. And the Duke laser disc repair, what you just watched, is the best in the world. Nothing comes close with results.
Next question from Faisal, once more on Facebook, asking, Doctor, I think the best way that people can improve and accept your surgeries is if you publish papers or have clinical trials which forces them to change their minds.
Yeah. So Faisal, thank you. Faisal's point is, doctor, I think the only way you're going to get traction with your treatment is to publish paper. Already done. Go look at PubMed. There's the publication. Done. It was done 13 years ago, 12 years ago, multiple publications. I have 8 peer-reviewed publications. It changes nothing. Absolutely nothing. That's because what controls our spine industry in the world are companies that make screws, rods, cages, spinal cord stimulators. It is the big, rich, wealthy companies that now create the science that you people lap up like a dog drinking water. Okay? Stupid. Be smart. Don't fall for their nonsense.
Next question. I can't tell if this is seeking advice or a question, but this is coming from Rita on YouTube, saying, "Hi doctor, I did finally get my MRI. Now I have to try and get the disc imaging so I can be able to see to see what you say. I have scoliosis, bulging discs. My hip is much worse. This is from my accident, so I'm trying, hoping once I'll raise somehow to get to you. They don't want to do here because of my Takayasu, but you said if I'm stable, you think it's safe. Can't live in a bed all the time."
Rita, yeah, I've read Rita's comments before. Thank you for joining us, Rita. I'm so sorry you're suffering. Rita, baby steps. You've got the MRI, get it to us. All you got to do is upload it on our website, go to our web portal, and do the free MRI review. Check the boxes. Open your file on your MRI by using a zip drive or CD on your computer and drag and drop the contents of the folder into our portal. Or just mail the CD here to where they give you the directions on the website. It's a MRI review at Duke Spine, and it gives you the address. Once we receive it, we will schedule your MRI review, Rita. If you want your CD back, you must send a prepaid postage envelope to us, and we will put it in there when we're done and send it back to you. You need a diagnosis, Rita. I will tell you what's wrong and how to fix it. Whether or not you can get it done, that's up to you, but we are ready to fix people's spines. We just need them here getting it done.
Next question from Ramazan. These next 2 questions are from Ramazan on YouTube. First one asking, "Hi doctor, can you fix mild canal narrowing at C5-6, C6-7 from the neck? This surgery is laser surgery or facet joint treatment?"
Yeah, Ramadan. So to fix your stenosis, you need Duke laser disc repair, nothing else. And again, everybody out there, including Ramadan, thinks that they know what they need, but they don't. You don't. You don't need mild stenosis fixed. Mild stenosis causes 0 symptoms. What you need fixed is what I tell you need fixed. If you're having pain and it's coming from the disc, you need the tear in the back of the disc that are causing the pain fixed with laser. If you have facet joint pain and it hurts to turn your neck side to side, then you need the Duke plasma rhizotomy for the facet joints that are hurting you. It's my job to figure out which facet joints, which discs need to be treated, not yours. So get me your MRI and stop trying to guess what you need done. You will never guess it. Maybe if you listen carefully to me and work with me as my assistant for a couple of years, you'll be able to make the diagnoses that I make. But remember, 99.9% of neurosurgeons in the world can't make these diagnoses, and these are the smartest doctors in the world.
And then lastly, coming from Ramazan once more on YouTube, asking, "Unfortunately, I'm not local, not easy to come to Florida, but I will. Meantime, do you recommend anything to get rid of the pain, like swimming or physiotherapy, or can I get benefits with any exercise with my neck problems?"
Yeah, Ramadan, great question. So first of all, we don't know why you're having pain, but I suspect it's going to be disc or facet or both. Can you get relief doing something other than our treatments here at Duke Spine Institute? You can get relief. Shots, usually epidural shots or steroid shots in the facet joints might help. Muscle relaxer can help. Anti-inflammatory can help. Oral anti-inflammatories. Stretching. Walking is the best exercise you can do. Swinging your arms. Swimming is great. Just try not to lift anything heavy. because that can make it worse. Aside from that, you just need to get to Duke Spine and get fixed, my friend.
That is it for questions.
All right, great job, Henry. We enjoyed the questions today.
Yes, we did.
Our patient is already out of the operating room and she's almost going home. She's going to go home in about 20 minutes. Now, the next patient is coming from Minnesota. And she's got a lot of tattoos, I will warn you. But she loves her tattoos, and I'm going to try not to mess any of them up. But she's going to have Duke laser disc repair for a painful disc at L45. She's going to have the SI joint Duke plasma rhizotomy for SI joint pain. She's going to have a piriformis muscle release. And I think that's it.
And then also a 2-level DPR on her thoracic.
Sorry, she's also having thoracic facet pain. We're going to do a 2-level DPR on the thoracic. I think we'll start with the DLDR, and then we'll do maybe the thoracic DPR, and then we'll do the SI and then the piriformis.